Okay, fluid and electrolytes, the basics. Okay. Objectives, I'll let you read those on your own. You don't need me reading them to you. Body fluids, components, water and chemicals, electrolytes, substances that carry an electrical charge, either positive or negative. Acids release hydrogen ions into the fluid, and bases bind with the hydrogen. Purpose is to regulate fluid volume, buffer blood to keep it at a normal pH. Body fluid components, 60% of the body is water. That's approximately 2/3 of the body is water. There is extracellular, intravascular, and interstitial fluids that are out there that keep track of things. Intake and output. An average fluid intake for an adult is about 2,500 milliliters a day. Ranges from 18 to 36. The older and younger people, they take in about 18. You and I, younger folks, take in about 3,600 mils a day. Source: food, liquids. Fluid elimination source: urination, bowel elimination, perspiration, breathing. Just breathing takes away water. Insensible loss, sweat, exhaled air, so on and so forth. Okay. Physiological process: translocation of fluid and exchange of chemical electrolytes. Causes of you've got 5 processes. There's 4 of them listed here. You get to pick out the other one. There's osmosis, movement of water through a semi-permeable membrane. Then there's filtration, promotes movement of fluid according to the pressure difference. Passive and facilitated, there's the other one. Diffusion, example, insulin facilitates distribution of glucose inside the cell. Active transport is a sodium-potassium pump, requires ATP. Mechanisms to maintain normal fluid volume and electrolyte concentration. There's osmoreceptors, neurons that sense blood concentration, stimulates release of ADH, antidiuretic hormone, baroreceptors. There's the renin-angiotensin-aldosterone system. Chemicals released to increase blood pressure and blood volume. Then there's the neuroleptic peptide ANP and BNP released, increases urine production. Okay. Fluid imbalance 1. Okay. Hypovolemia. It means low volume of extracellular fluid. Causes vomiting, diarrhea, wound perfusion, all those type of things. Vital signs: you have hyperthermia because of low water, tachycardia because you have low amount of water in your body, so therefore you have to have your heart beat faster. You have a thready pulse, which is which they say is a weak pulse. It's not real strong. You have hypotension. You have low blood pressure. Tachypnea, which is a rapid breathing. Hypoxia. Neuromuscular, skeletal things that can happen with this is dizziness, syncope, and confusion, weakness, and fatigue. Now, with imbalance number 2 is just the opposite of imbalance number 1. It is hypervolemia. It's high volume of water in the intravascular fluid compartment. Causes excessive oral intake, IV fluids, heart failure, kidney disease, adrenal gland dysfunction, all kinds of things. So as you move forward, you're going to find tachycardia, but a bounding pulse, not a thready pulse. You have hypertension instead of hypotension. You have tachypnea. So the body's trying to get rid of that extra water by having you breathe faster. You have neuromuscular, you're weak, you have a headache, you have altered level of consciousness. Gastrointestinal, you have ascites. It's extra water in between the skin. Respiratory, you have crackles, cough, increased respiratory rate, dyspnea, other things that can go wrong. You have peripheral edema, weight gain, increased urine output. Lab values for this, you have a lowering of your hemoglobin and hematocrit. You have a serum and urine osmolarity decrease, and you have a decrease in urine sodium and specific gravity, and a decrease in your BUN. Next one, you have nursing care plan, which you can look at and see what you're going to do. Question 1. A client is at risk for impaired skin integrity due to a compromised circulation related to the heart failure. Interventions to maintain intact skin include A, B, C, or D. Okay? So you have to think about that for a minute. The actual is C, apply elastic stockings, because that pushes, supports the valve and pushes the fluid from pooling in dependent areas. All right, third spacing. You have a translocation of fluid from the intravascular to tissue compartments, and it causes swelling, and it's quite pronounced on some people. Electrolyte imbalances occur as deficits and or excess accompanied by fluid changes. Causes, deficits, administration of IV fluids, vomiting, diarrhea, diuretics, all that kind of stuff. Priority is electrolyte imbalance of sodium, potassium, calcium, and magnesium. So, hyponatremia is less than 135 milliequivalents per liter. Causes can be quite pronounced. Diaphoresis, oops, didn't know why I did that, but anyway. Assessment findings: mental confusion, muscular weakness, anorexia, elevated body temperature. Medical management: foods high in sodium, high IV sodium chloride. For hypernatremia, which is the opposite, you've got a sodium level of 145 milliequivalents per liter or greater. Medical management is water intake. You restrict the water intake. They're thirsty. They got dry, sticky mucous membranes, decreased urine output, fever, things like this. But you need to make sure that you're doing okay. So they usually limit their water, and they limit the amount of sodium going through their IVs. Nursing management: INO, strict INO, assess their vital signs, dietary restrictions or supplements. Function: to maintain normal nerve and muscle tissue. This is for hypokalemia. So that's what potassium does for you. Hypokalemia is the result of an increasing in potassium loss, or movement of potassium into the cells without the corresponding need for it on the outside. Expected findings is fatigue, urinary retention, vital signs: weak, irregular pulse, neurological, they're lethargic and confused. EKG or ECG, flat or inverted T waves, prominent U wave, which you don't usually see, ST depression, gastrointestinal is hypoactive bowel tones, nausea, anorexia, constipation, abdominal pain and distension, muscular weakness, depressed deep tendon reflexes, and leg cramps. Now, hyperkalemia, which is just the opposite of hypo, your potassium level is above 5.5 milliequivalents per liter. So expected findings, hyperkalemia is increase up your risk of cardiac arrest. You have fatigue, vital signs, you're slowing heart rate or pulse, hypotension, neuromusculoskeletal is restlessness, apathy, confusion, irritability, and absent reflexes. So that's just the opposite of hypokalemia. So hypocalcemia is a function of blood clotting, transmission of nerve impulses regulated by the parathyroid gland. Total calcium of greater than 9.0. Excuse me, I didn't miss my decimal point there. Milligrams per deciliter. Expected findings: tetany, muscle twitching, frequent painful muscle cramp spasms, positive Schaffhausen sign and Trousseau sign. Vital signs: you have a weak pulse, hypotension, confusion, anxiety, psychosis, seizures, hyperactivity, deep tendon reflexes, or hyperactive deep tendon reflexes, paresthesia of the fingers, toes, and lips. That's that numb, tingly feeling. Neuro, confusion, anxiety. I already did that. Sorry. Dysrhythmias for the cardiovascular. Prolonged QT greater than 0.45. And ST segment prolonged also. Gastrointestinal, hyperactive bowel tones, diarrhea, abdominal cramps. Hyperkalemia is just the opposite. It causes parathyroid tumors. You can have IV sodium chloride, Lasix, corticosteroids, or plicamycin. Diet, teaching, fluid, fall safety, deep bone pain, constipation, anorexia, polyuria, and pathological fractures happen with this. Okay? So magnesiumemia, hypomagnesemia. That's a hard one for me to say. It's a function of transmission of nerve impulses, activation of enzyme systems, including functioning of vitamin B. Alcoholism is one of the causes. Diabetic ketoacidosis, renal disease, burns, malnutrition, intestinal malabsorption, diuresis, prolonged gastric suctioning. So if you have a patient on a NG tube, they're going to sometimes replace the amount of fluid coming out there in their IV. So a serum magnesium of less than 1.3 milliequivalents per liter. Okay. So hypermagnesiemia is caused with renal failure, Addison's disease, excessive antacid or laxative use, hyperparathyroidism, flushing, assessment findings, hypotension, lethargy, bradycardia, muscle weakness, coma. So, I mean, it can get quite serious. Serum magnesium level of 2.1 milliequivalents or higher. Decreased oral magnesium or parenteral replacement. Mechanical ventilator. I mean, you can get much problem with this that you actually need to go on respiratory support. So question number 2, which of the following interventions would be appropriate when caring for a client with hypercalcemia? Fluid, bed rest, administration of calcium supplement tablets, this is hypercalcemia, and administration of antibiotics. Okay. Let's see what it says. Oh. It doesn't say. So you get back to me on that one. That can be part of your discussion questions. Regulation of acid-base balance. Now, acid-base balance is what your blood plasma has. So your pH is 7.35 and 7.45. That equals a normal pH volume for your blood. You have carbonic acid and bicarbonate, H2CO3, and then you have the bicarbonate, which is HCO3. That's your kidneys. Chemical adding and removing hydrogen ions from your blood. Organs that are involved: lungs regulate the carbonic acid levels, and the kidneys regulate the bicarbonate levels. Decompensation. Imbalances types. There is acidosis, which is an excessive accumulation of acids or excessive loss of bicarbonates in bodily fluids. And then there's alkalosis, which is the excessive accumulation of base and loss of acids. All right. Acid imbalance number 1, metabolic acidosis. Cause: shock, cardiac arrest, starvation, diabetic ketoacidosis, there that again, renal failure, aspirin overdose, loss of interstitial fluids, and wound drainage. This one here, its pH level is dropped below 7.35, okay? So respiratory acidosis, your pH has dropped below 7.35. Also causes pneumothorax, pulmonary edema, asthma, pneumonia, drug overdose, head injuries, CSF, cerebrospinal fluid. Assessment findings: cyanosis, tremors, and arterial blood gases values are determined the acid-base balance, pH, HCO3, and PaCO2. Okay. Respiratory alkalosis, which is a pH greater than 7.45, causes anxiety, fever, overactive thyroid, aspirin poisoning, mechanical ventilation. These are they come in, they're hyper breathing, they have paresthesia, they're sweating, they're panic. They need to have one way of doing this is decreasing increasing their CO2 is by having them breathe into a bag. Sedation. You give them sedation, they stop breathing so fast. Okay. Question: which acid-base disturbance would be most characteristic of a narcotic overdose? Okay, a narcotic overdose. Metabolic acidosis, respiratory acidosis, metabolic alkalosis, or respiratory alkalosis. It's respiratory acidosis because they stop breathing because it's a narcotic and it slows their rate of breathing. So what have you done? Okay, I hope you enjoyed it. I did. I'll talk to you later. Bye.